Systemic lupus is not just one disease, but many. It can quietly attack the skin, joints, kidneys, brain, and virtually any organ in the body. Because lupus can affect multiple organs, symptoms vary widely from person to person. Common general symptoms include fatigue, weakness, low-grade fever, and sensitivity to sunlight. Sunlight triggers the death of skin cells, a process called apoptosis, increasing antigen release and immune complex formation. Skin manifestations often appear first. Classic signs include a butterfly-shaped rash across the nose and cheeks. Discoid lupus causes red scaly lesions that can lead to permanent hair loss if they appear on the scalp. Rashes can develop elsewhere after sun exposure, and mucous membranes in the mouth, throat, and nose can also be damaged. Lupus commonly affects the joints, typically the small joints of the hands and knees, although other joints can also be affected, causing pain, redness, and swelling. These symptoms often improve fairly quickly with movement. The heart and blood vessels can also be involved, causing pericarditis and inflammation of the heart lining. A specific type of heart valve damage, called Lehmann-Sachs endocarditis, can result in heart failure, heart attack, or stroke. Inflammation of blood vessel walls or vasculitis may further damage organs. Lupus also accelerates atherosclerosis, increasing cardiovascular risks. The lining of the lungs, or pleura, is frequently affected, which can result in fluid accumulation around the lungs, also called pleural effusion, while lung inflammation may mimic infection. Kidney inflammation or nephritis is a serious complication of lupus. It often presents quietly and, if not treated, may lead to high blood pressure and kidney failure, potentially requiring dialysis. Lupus can sometimes affect the brain, resulting in numerous neurological and psychiatric issues due to inflammation of the brain's blood vessel walls or thrombosis. Common symptoms include headaches, seizures, and memory impairments. Behavioral disorders and psychosis may happen either as a consequence of lupus itself or from corticosteroid therapy used in its treatment. Blood disorders such as anemia and low white blood cell and platelet counts are common. Although fertility rates in women with lupus are similar to those in the general population, there is increased risk of miscarriage, premature birth, and fetal complications, particularly if pregnancy occurs during active phase of the disease. Therefore, women with lupus who are pregnant should be closely monitored. Currently, there is no cure for lupus. Complete remission or absence of disease activity without treatment is only achievable for approximately 10% of affected individuals. For others, the disease tends to have a prolonged course with occasional flare-ups. Some may develop a certain degree of disability due to chronic fatigue, joint issues, and kidney damage. In such cases, the aim is to achieve minimal disease activity with mild symptoms using the least amount of medication possible. This goal can be attained in about half of the cases. Additionally, some individuals may face serious complications within the first 10 years of the disease, often resulting in death from infections, thrombosis, or kidney failure. While lupus remains incurable, advances in treatment and growing awareness mean more people than ever are living fuller and longer lives. Understanding the disease is the first step toward managing it. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.